Staying at the front lines of the global battle against Ebola, a British man who survived the virus wants to donate his blood to help create a cure. Richard Bestick has more now from London.
Thank you.
Chris Pooley's already returned to Sierra Leone. This time he'll be giving blood, which it's hoped will contain valuable Ebola antibodies. As he returns, 164 other British health workers are currently in training to do battle with the Ebola virus in West Africa. Here in Britain, a nationwide response exercise highlighted the UK's preparedness for Ebola. The UK government's chief medical officer has been answering concerns from parliamentarians about the spread of Ebola to Britain's shores.
Planning at the national level has been excellent, and the work with the exercises show that people have got plans in place and good response mechanisms.
However, there were concerns about the UK's voluntary screening of travellers from the worst-hit countries in West Africa, Sierra Leone, Guinea and Liberia, and the means of tracking those who refused medical checks.
I share your concern. It is important not only to do the planning and send things out, but to make sure it gets to the right people and they get the training.
And there was reassurance in Sierra Leone itself from Britain's International Development Secretary Justin Greening, who has visited the site of a UK-funded Ebola treatment facility.
It'll be providing 92 beds for patients, of which 12 will be dedicated for healthcare workers, providing people who are coming here to provide healthcare support the reassurance that if they do get sick, in spite of all of the work we're doing on training, that they will be able to make sure they get the treatment that they need.
That Ebola is under scrutiny here at the UK Parliament says two things. One, yes, it's an international crisis, but also it's evidence of a deep concern in Northern Europe that the disease could spread to this region. Richard Bestick, CCTV, London.